Good evening, everyone. My name is Tori Lindley. As the president of the National Athletic Trainers Association, I would like to welcome everyone to understanding the risks and benefits of sports participation during the pandemic. This will be the first of a three-part parent and caregiver focused discussion series titled Play-Informed Sports and Recreation During the Pandemic. This series is hosted by the National Athletic Trainers Association, the American Academy of Pediatrics, and the American Medical Society for Sports Medicine. It brings together pediatricians, sports medicine physicians, and athletic trainers who have a focus first and foremost on the health and well-being of the youth athlete and the patients we serve. We know that right now is an uncertain time, especially for parents. So today, we hope we will leave you more informed, better connected, and feeling empowered to make the best choices for your families when considering a return to sports and how to best keep your children active and healthy during this unprecedented time. With that said, it's my honor to introduce you to our moderator for this evening, Rich Dubin. Rich is the CEO and publisher of MVP Parents Magazine. Rich, thank you for hosting tonight.
As President Lindley said, my name is Rich Dubin. I've been in medical publishing for over 30 years. I founded the clinical publication Lower Extremity Review, father of four. I've been involved in every aspect of youth sports for over 20 years. I actually have a daughter going off to play basketball in college, although we still don't even know if there'll be a season. I've seen it all. I've learned a lot about parenting, communication, coaching, safety, and so much more. Last year, I launched MVP Parent Magazine to educate the parents of youth athletes about performance, injury prevention, safety, nutrition, sports psychology, and more. Now we are in some trying times, and all of us know that COVID-19 has affected our families and the lives of our youth athletes in a big way. And when it comes to youth sports, the landscape continues to change hourly. So we must stay informed and remain vigilant. I'm honored to be selected. I'm very excited to moderate this educational series on behalf of National Athletic Trainers Association, American Academy of Pediatrics, and the American Medical Society for Sports Medicine. We brought together leaders in the field to provide some clarity and give us the information we need as parents to help navigate these challenging times and determine what's best for our athletes and our families. So we're going to deal with a few housekeeping items. Attendees, we'll have a Q&A period at the end of tonight's discussion. As time allows, please use the chat feature to submit your questions for the panel. Also, these discussions will be recorded and available later in the week. We encourage attendees to download and share the resources and information shared during the educational series and discuss what you learn with your family and your youth athlete so he or she can play informed.
Totally.
So now I would like to introduce our esteemed panelists. We have Dr. Shelley Fisk, Medical Director of the Vaccine Preventable Disease and Immunization Program, Health, District 4 Chair for the American Academy of Pediatrics Board of Directors. Dr. Margot Putukian, Director of Athletic Medicine and Assistant Director of Medical Services for Princeton University, Consultant Chief Medical Officer for Major League Soccer, past Chair of the U.S. Lacrosse Sports Science and Safety Committee, and member of the U.S. Soccer Medical Committee. Dr. Rebecca Lopez, Associate Professor for the Department of Orthopedics and Sports Medicine at the University of South Florida's College of Medicine, Chair of the National Athletic Trainers Association LGBTQ+ Advisory Committee. So we all know this is a really important topic. Welcome, everybody. I'd like to get started. First question to Dr. Fiskus. So it's a three-part question. What is COVID-19? Are children truly susceptible, and can they actually spread the virus?
Yeah, great question to start out with so we can kind of all get on the same level playing field. So we hear a lot of different terms that get floated around COVID-19. So there's COVID-19, there's SARS-CoV-2, there's coronavirus. They all kind of refer to the same disease. So the SARS-CoV-2 is a coronavirus. It's a type of virus. It's in the family of coronaviruses. And this particular one is the SARS-CoV-2 virus, which just means it's the second coronavirus to cause a syndrome referred to as SARS, which is severe acute respiratory syndrome. So you may have heard a few years ago there was a virus that caused an outbreak of SARS. That was the first SARS, and that happened mostly in the Middle East. And we didn't really get impacted by that here in the United States, but this one came over, as we all know, and this particular virus is what causes the disease, which is referred to as COVID-19, which is coronavirus disease of 2019. So it's named after the year that it was first identified, which was in 2019 when it was first identified in China. So all of those terms kind of refer to the same thing, but the SARS-CoV-2 or coronavirus is the virus, and COVID-19 is the disease that results from the virus. As for your question about whether or not children are affected, this is something that we're still learning a lot about. As it feels like we've been dealing with this forever. In the United States, we've been dealing with this for about 7 months. So we still have a lot to learn before we truly understand everything. And so it can get kind of confusing with the data that come out. Are children impacted? Are they not? So what seems to be true is that children are less likely to become infected with this virus, are less likely to have severe symptoms from this virus, and are less likely to die from this virus than are adults. That doesn't mean that they're not impacted, and they are impacted. As of now, we have close to 250,000 cases of COVID-19 in children in the United States. That's not a small number. They generally do well. They generally have fairly mild symptoms, but we do see children who get hospitalized. And when they get hospitalized, about 1/3 of them end up in intensive care units because they require some kind of life support, whether that's ventilator or dialysis or medications to try to keep their blood pressure up. So we can see serious outcomes from SARS-CoV-2 infections in children. And we have had some deaths in children too in the United States. And so those numbers are very small, but if it's your child that's impacted in that way, then that doesn't feel very small. I think the other really important thing to understand is that most children don't live by themselves. And so they are living with parents or grandparents, or they have teachers or coaches who may have higher risk conditions that put them at risk for complications from COVID-19. So we know that the older you are, the more likely you are to have serious complications from that. Certain conditions in adults like high blood pressure or obesity could impact adults and make them more susceptible to have serious disease. So it's important that we keep children healthy, even though the risk to children seems to be fairly small at this point. When we talk about whether or not children can spread the virus, the data on that has kind of gone back and forth too. So initially it was thought that, kids are going to be the vector. That's going to be how this virus spreads everywhere. And then we found out, no, that's actually not true. And there's not as much evidence to show that kids spread this virus to the adults or the other children in their lives. There have been some studies that have come out this summer around children, especially in sleepover camps. There was a recent report out of Georgia where children who were staying in a sleepover camp, even though they had all tested negative to COVID-19 before they came to camp, a very large number of them ended up being positive when they were exposed to COVID-19 in that camp. So we know there is transmission between children. We know there's transmission between children and adults, but we are still very, very early in this process, and we don't test nearly as many children as we do adults. So it's a little bit hard to put our fingers just yet on how many cases we actually have out there.
Gotcha. Do we know if there's any certain conditions that make kids more likely to become ill?
I think The conditions that we've seen most commonly in children who have serious COVID-19 complications are asthma, which makes sense because most people who suffer ill effects from COVID-19 have respiratory symptoms, and then sometimes obesity and sometimes prematurity. But the majority of children who've had serious consequences from COVID-19 have not had those pre-existing conditions.
Gotcha. So what do you think all this means for physical activity and sports? Like who should participate and what factors would impact those risks on playing?
Yeah, it's hard to know exactly what to do, right? I think this is what everybody's struggling with. So there are certain children who may have more complicating underlying conditions that will want to have a discussion with their physician before they decide whether or not this is an environment where they should be participating in sports. But we know that sports are really important to kids. They teach teamwork and problem solving and how to work with groups of people, and they promote self-esteem, and children who participate in athletics are more likely to have to do well academically than children who don't. And so it's really important that we try to get kids into sports wherever we can. It's just a matter of striking that balance and doing that as safely as we can, and a lot of that has to do with the environment that you're in right now. So some counties and some states have very little activity with COVID-19 right now and really low transmission. And other areas, unfortunately, are very heavily impacted by this right now. And all of those things have to be taken into consideration when making those decisions.
Exactly. Dr. Patukian, would you like to weigh in on this one?
Sure. I would just reiterate what Dr. Fiskus just mentioned. I mean, I think it's really important for our kids that they're physically active, not only for their physical health, but also for their mental health. And certainly the decision to participate in sport is going to be an individualized one for the kid and their parents. There's certainly some issues as it relates to kinds of sports and activities. There's less of a risk if you're participating in golf than if you're participating in wrestling, for example, right? So there are some things that with this particular virus, we have to be mindful of as it relates to the ability to socially distance, the ability to, maintain some kind of activity without putting yourself at risk, with COVID. And so, I mean, again, that's going to be a very decision based on whether or not the sport involves a lot of people, and whether it's a contact sport, whether it's a sport that's played inside or outside, whether it includes equipment, whether there's any kind of traveling entailed. And so again, I think it's the take home is that we know that exercise is good and we want our kids to be active. And I would anecdotally tell you that there's very little that we know about exactly the transmission in sport. And it seems to me that much of the transmission of this virus occurs outside of the playing field or off the court. And when people are having meals, and they don't wear face masks and they're eating, or they're traveling, or they're in a plane, or they're in a bus. And so I think it's, as we learn more about how this virus is spread and transmission, we'll learn more about what the exact risk is with sport itself.
Good point. So, Dr. Lopez, do you, with the communities opening up and youth sports leagues and high school practices, as well as competition, including travel sports, is it safe? And what do you think things should some parents consider when deciding if their child should participate in that?
Yeah, that's a great question. I think whether it's safe is a really difficult, it's not a yes or no answer by any means. So I think looking at the organization of the sport, whether it's a state high school association or the individual school or sport organization, and see what kind of safety protocols they have in place. Are they screening at all? Do they have ability to have individual equipment, have their own equipment? Do they have a way to hand washing, socially distance? and things like that. So I think looking at the actual organization, the administration, and how they're handling it. Are they wearing face coverings whenever possible? So like Dr. Patukian was talking about, if they're traveling, if they're having a team meeting, if they're just going over the learning chalk talk aspect of the sport, are they all wearing masks when, it's a really good opportunity for learning, but also social distancing might be a little bit difficult. So those are the things that I think parents should be looking at.
Mm-hmm. Good, very good. It kind of goes to what we're talking about. We have a low risk sport, and some other sports are considered high risk. I don't know that a lot of parents necessarily understand the difference and how that's even determined. So I put that out to anyone, one of you that would like to weigh in on that.
Yeah, I mean, I'll take a stab at it if you want. I mean, I think a lot of times the low risk sports are things like golf, running, tennis, right? And they're individual sports where there's not a lot of contact, and say for tennis, the only thing that's potentially there is the ball, right? That you're hitting back and forth. And so on the opposite side is a sport like wrestling or rugby, where there's contact. It's extensive. It's kind of hard to get away from contact in the sport of wrestling. It doesn't mean that you can't participate in wrestling. It just means that you might want to think, if you're the coach or a parent, that you want to try to put the focus on skill development or individualized pieces as opposed to the full-born scrimmage component or going live in wrestling, for example. The other thing that seems to be playing a role is the venue. So if it's outdoor activities, it's a little bit safer than if it's inside and the ventilation isn't very, very good or the space is small. So the main thing is just contact and space in terms of the risks.
Yeah, good point.
And I'd add about transportation as well. We mentioned a minute
Great
ago
point.
about the considerations around transportation. So if you are in a community that has fairly low transmission rates and you're in a maybe a higher risk sport like football, but you're traveling your team to a community that has a much higher incidence of disease. So, I'm in Tennessee. Our metro areas like Nashville and Memphis have very high transmission, but we're going to have counties with football teams that are surrounding those metropolitan areas that could be traveling into those areas and coming back. And so that's one way that disease can be spread, is by moving into those different areas. And then also just being confined on a bus for a period of time. The importance of people wearing cloth face coverings while they're on those buses, having the windows open so there's air circulation if the weather is amenable to that. Trying to be seated on the bus so that there's space between you and the next person, especially if the ride's long.
Yep.
There's lots of those kinds of considerations that need to be taken into account, regardless of which kind of sport that they're playing too.
No, you're absolutely right, Shelley. I think, and actually, like I said before, I really think there was a study, I think in German soccer or football, German soccer, that actually found that the average amount of time that individuals were in close contact while they played was 12 minutes. And so the bus ride, to the away place is probably more of a risk than actually the sport itself.
Yeah.
So that piece, exactly.
Great point. We're talking about physical distancing and social distancing, and the question comes, how do kids really do that when they're playing sports? I mean, Dr. Lopez, like how is it? I mean, you said they're in contact 12 minutes during the game and what have you, but there is this aspect of the travel and everything else that comes along with getting to and from the event. How do they actually maintain that social distance and that safety?
Yeah, it's very difficult, and as been said, I think it depends on the sport. There are absolutely skills, practices, and conditioning activities that could be kept so safely physically distanced, like sprinting or conditioning, or even ball control in soccer, where they're passing the ball back and forth from a safe distance. But when you're talking about actual competition in soccer, basketball, football, any sport where there is contact and or collision, I think it's really difficult if you're actually playing the actual competitive sport. to keep that safe distance and be able to participate in the sport. So, but there are different things that, you know, coaches and organizations can do, like doing, if they're not competing yet, doing actual skills, conditioning, and other activities where they're still be able to continue their advancement, improve their performance, but still keeping a physical distance from their teammates, but not from the opposing team, I would say.
Yeah, excellent. Then we go kind of, you know, what do parents, like, what should parents know about positive cases on the team? You know, whether it be their own child or a teammate, you know, how long should the family quarantine? Is it safe for them to, when is it safe for them to return to play? What are some of the long-term effects that we should be concerned about as parents? If there is someone on the team that we hear is affected, or if our child is affected, how does that impact our decision, Dr. Fiskus?
Yeah, so first let's talk a little bit about what close contact is. So the CDC defines close contact as being within 6 feet of an individual who's infectious for 15 minutes or more. So 15 minutes is kind of a long time when you think about it. You know, that's not going to be two people passing in a hallway at school. That's not going to be people who are, you know, maybe going up to tee off in golf and who have maybe a passing exposure to one another. But it is going to be people who are sitting in maybe a wrestling room on the mat, who are training if they're not socially distanced, if they're not wearing masks, and so that's where we want to be careful. And so the most important thing to understand about this virus is that it's looking for its next host, and if we can prevent it from finding that next host, then that's how we get to stop a pandemic. So the ways that we do that is by keeping people 6 feet apart, and the reason for that is because this is a virus that is transmitted through droplets. So basically spit while you're talking. And those are heavy droplets. And so they don't go out very far before they fall to the ground. And so if you can keep a distance, then you're not getting that exposure. And then if you're wearing a mask, then those droplets tend to get caught inside your mask and not go to the next person. So when you talk about, say there's a case on a team, one of the best things that a coach can do is cohort their team to an extent, which means breaking their team up into smaller groups that stick together all the time. So for example, a local high school football team near me just had an exposure, and it was in a linebacker. Well, the linebackers are not practicing with the offensive line, are not practicing with the special teams guys. They're in their own little cohort. And so when that exposure happened, yes, that small group of linebackers were the close contacts of this infected individual. And they unfortunately have to be quarantined, and that's for 14 days from that last contact. But the rest of the team was not exposed. And so you don't have to worry about putting people who are outside that 6 feet for 15 minutes bubble into a quarantine. But if you are identified as a close contact, then that's 14 days at home, not going anywhere. Not exposing other people to you, because you could be incubating the virus at that point. And we know that a lot of people shed that virus without having symptoms, and we want to make sure that you're not going to be the one doing that. So it's 14 days. If someone on a team tests positive, the recommendation is that those close contacts do get tested, just to make sure that there isn't asymptomatic spread or people who are infected with the virus. Just because that one kid on the team was the one that ended up with a positive test doesn't mean he didn't get it from someone else on the team who also, we just don't know, has a positive test. So they do recommend, CDC recommends that you test their close contacts. As far as long-term outcomes from kids who are infected with this virus, we just don't know. We don't have long-term yet. We have 6-7 months of these kids. We do know that some children can go on to develop a syndrome called MIS-C, or multi-system inflammatory syndrome, in children, and that is a rare but quite serious illness where children who were infected with the virus and maybe didn't show much in the way of symptoms, maybe didn't show any symptoms at all, can become seriously ill 2, 4, 6 weeks after that infection. And a good number of those children end up in intensive care units, some on ventilators, some on dialysis, many with some heart disease as a result of it. And we don't know what the long-term impact of that type of reaction to COVID-19 is. So it's still important to make sure that we're taking every precaution we can to keep our kids safe.
Absolutely. Absolutely. And it brings us to the next question. And, you know, as if a family's high risk and won't be returning to sports, or if the family, state, school district has postponed the sport, what can parents do to make sure, you know, that their child is still physically active, that their child is still getting out there and participating in the world? Because as we know, many of them are sitting at home and on their phones or on, you know, on gaming systems and all these things, because it's taken such a part of their life away. So what do you think of that, Dr. Patukian?
I think it's important for our kids to be active. I mean, I think that's such an important piece of what they do, especially those that are young and that have been involved in any kind of sport. So, I mean, I think some of the guidelines really that we try to give to our college kids apply for kids too, which is, you know, establish some routines, get good sleep, get good nutrition, spend some time outside, spend time, you know, with, you know, developing relationships and all that. Understand your support network and the resources that you have. But, you know, we want to encourage individuals to be active and participate in their sport. And there's no reason why they can't continue to do whatever their sport is. If they're a basketball player, you know, there are outdoor courts that are ideal for being able to participate. If you're a soccer player or you're a runner or whatever your sport is, you know, you certainly can still train and condition and do the things that you do as an athlete, and then try to remain connected somehow with your teammates and your coach. And, you know, I think there's a lot of things that we want youngsters to do, and paramount is the idea that they should be active. They should be participating.
Absolutely. Absolutely. And so beyond that physical activity, you know, what other things, Dr. Lopez, do you think parents should be concerned about when the athlete can't participate? You know, when there's, you know, something that, you know, they're trapped, so to speak.
Yeah, so as Dr. Patukian mentioned, the physical aspect is extremely important in maintaining the fitness and performance. But aside from that, parents should definitely be aware of the mental health of their child, especially as the child is a little bit older, more competitive, like high school, where that, you know, athletes their identity revolves around being an athlete. So if there's a point where they're not competing and they feel like their identity is off, then mental health is definitely a concern, and making sure that they're monitoring for signs of depression or anxiety. But I think, you know, taking that mental aspect and the psychosocial aspect, as Dr. Patukian mentioned, is staying involved. So whatever they could do socially in a safe way, whether it's through virtually like we're doing right now, or safe workouts where they're able to do workouts, but at a safe distance, any kind of involvement, and something that's going to allow them to maintain their identity as an athlete, as a competitor, I think would do really well in that respect, because it's going to be emotionally difficult for an athlete if their season gets postponed. It'll be difficult for the parents that are excited for that upcoming season if it gets canceled. So all around, just the psychosocial aspect and the mental health aspect are really important. So anything they could do to stay involved, continue to socialize safely, and the physical aspect, continue to train in any way that they can, just for their own mental well-being.
Mm-hmm. Yeah, I deal with that myself, you know, as a parent, you know, with a daughter going off to play in college, and we don't even know if there's going to be a season and what's happening, and just trying to keep her engaged and active and participating and keeping that competitive energy and that competitive drive has been really important for us. And I have a younger daughter as well that's home, and she plays basketball as well, and getting her out, shooting in the yard, you know, handling the ball, just even talking to friends, and, you know, with social distancing has been extremely important. That Originally we were all on lockdown, right? So no one went out. Everybody was quarantined. We didn't see anybody. And then as she got more and more comfortable, and as we got to get a little more knowledge and a little more experience with what's happening, we felt a little more comfortable getting her out and seeing certain people. And it's made such a difference for her mental state.
Yeah, for sure. You know what, Rich, I was just thinking the same thing. Like, one of the things that Dr. Lopez pointed out is just the mental health piece. And there's so many emotions that come along right now that different athletes will experience, disappointment or loss, sadness, certainly anxiety, fear. And one of the things that I've learned from a colleague is he mentioned sort of the uncertainty. And, like the uncertainty that involves, just as you're pointing out, like your daughter's situation. And one of the things that this colleague pointed out was that it's real helpful to sort of accept that there's going to be some uncertainty, and accept and sort of not embrace anxiety, but embrace to some extent the anxiety that goes along with it. Because if you sort of, it's just part of being human. Right. So, and try to focus on the things that you can do, but being aware of those feelings and being able to acknowledge them and understand that that's completely normal and part of what we're all experiencing as human beings, I think is pretty helpful.
Absolutely.
And from a parent standpoint too, acknowledging our own feelings and being willing to talk about that with our kids. So,
Exactly.
My son is a senior wrestler this year, and I am so bummed because I don't see how wrestling can happen.
Yep.
I just don't see how it can happen. And so I have just as much, if maybe not more, grief about this than he does, because my husband's been a wrestling coach for 30 years. And so we kind of, live and breathe that sport, and we got the kid who started wrestling, and now, here we are. And so it's important to be able to say to our kids too, I am so bummed about this, and how are you doing about it? And to admit that we're anxious about all of this too. And we're all anxious. Every single one of us is anxious. And being able to talk with our children about that, and being brave enough to admit to them, I have no idea what's happening either. It's a pandemic. Nobody's done this before. Nobody is alive right now who did this before. Very few people. I mean, if they were around in 1918, they were babies and don't remember it. This is really uncharted territory for all of us, and it's really important to let our kids know that we don't know what we're doing either as parents, and we're all kind of learning as we go, and we're all going to make mistakes. But it's also, there are ways to get out and do things that are safe. You can go to a store with a mask on and make sure that you wash your hands before you touch your face, and that you stay 6 feet from the person next to you. And you can go get takeout and take it to a park and have dinner outside that you don't have to cook, and where you can be social at a distance. And so there are ways to live through this, and I think we'll get more and more comfortable as time goes on. But it's important to show our kids where the boundaries are, and how we can kind of go right up to that point and then not cross over to the point where we're really putting ourselves at risk.
I completely agree. Rebecca, would you like to comment on that at all?
No, I totally agree. And I really appreciate Dr. Fisk's comment about, getting out and being social, and not just,
Exactly.
because mental health aspect, if you could just be doom and gloom inside your house and the season's canceled and we don't know what's going to happen. But I think, first of all, I think it's really important to have that conversation with your kids and be open about your own feelings as well, and how everyone is, in this together. But I think the mental health aspect of getting outside and being active and socializing in a safe way, I think is really key. So I totally agree with that.
I think you brought up a really good point too about parents, right? And we as parents, we have a lot of identity as well through our kids playing sports, right? We travel with them, we take them to their events, we watch them. And as a parent, like, we're not going to be able to watch live when and if they do have a season, we're not going to be able to be spectators like we were. So how does that affect us? Or I know how it affects me as a parent. I mean, we had a whole AAU schedule planned and registered, and we had travel and hotel rooms, and we were all set to go. And that plug got pulled, obviously. So, we've been able to talk about those feelings. And so it's important for us as well, not just to think our kids are going to be okay and leave them in their room or wherever, but to kind of encourage them and get them moving into life, back into life as we know it now, the quote unquote new normal, whatever that is. So I think as parents, we need to be more open with what we're feeling about the same situation. We get a lot of benefit out of that for sure. What else we got here? So I think, we can actually transition. I think we've covered a lot of our internal questions, and we can, let's see. Oh, we got another one here. What do you think we should, as parents, expect for the upcoming seasons, and how can parents prepare their child for sports during this time? I mean, I think we touched on a lot of that, but what do we expect? I mean, is it just an unknown and we're just going to sit around and look, hope for some information soon? I mean, what do you think? What do you think about that?
I mean, I think there's a lot of information that I'm actually feeling like there's a lot of different organizations that have come forward with sort of these phased return to play protocols, and many of them, most of them, even from the youngest youth sport level all the way up to the professional sport leagues that have published their, return to sport, phased return to sport activities. They're all the same. I mean, the groundwork is basically all the boring, non-glamorous stuff, such as the social distancing, the wearing a mask when you can, washing your hands, staying home if you're sick. I mean, I think we're also very much, used to all of this stuff, right? Don't share food, don't share water bottles, don't share towels, don't swap shirts after a match, don't shake hands, don't fist bump. In the sport of soccer, it's minimize the amount of time around set pieces or corners or arguing with the referee, and so, I mean, I think for each sport, those situations are there, right? Having our coaches and I'm not sure that all parents are going to be off limits. I mean, it kind of depends on the sport, right? But, the parents certainly are going to need to be using a face mask just like their coach should be. And, I think we just have to, and I really personally feel strongly that those are the areas of emphasis. I spent a little bit of time on my vacation down in the MLS bubble. And what we kept trying to instill upon the players was the importance of the social distancing, because we had a couple of teams that had outbreaks, and the two teams that had outbreaks basically brought it with them when they were in a plane, for 3 hours in an enclosed area, and they were, sharing, they were eating, so they were without their face masks. And another team was stuck on a bus for 3 hours while they waited for their plane. So, I mean, I think if you can control some of the other behaviors off the field, off the court, that's really where I think the transmission is.
Good point.
So.
Very good point.
I totally agree with that. The building the culture in our athletes and in everyone, hopefully, but especially in our athletes, that, if you want to play, then this isn't just behavior that you have when you're in school or you're in practice or you're on the field. This is behavior that you have everywhere you go to protect yourself, so that you're not bringing that virus back to your teammates and ending the season, because that's the way that this is going to go, is when we've got folks that are off on weekends and going about their normal socializing when they shouldn't be, and then they come back, it's too late at that point to be able to get things under control.
No, you're spot on. And I think the other thing that, a lot of people, at least at the collegiate level and I think at the high school level, they're sort of worried about testing. Why aren't we testing? We should be testing because that's what the pros do. And I think an important point to make is that, testing might help you with detection. And that's important in this virus because so many people are asymptomatic. But the transmission is, testing doesn't do anything about that, right? So the way that we prevent transmission is to do all the boring stuff like wash your hands, and stay home if you're sick. And that becomes really important for our healthcare providers too, right? They should stay home if they're sick, right? So I think there's a lot of areas where we can, like you said, just sort of getting into that mindset of creating the culture of safety that's going to be so important.
Yeah, and I think at the high school level too, and for the parents, maybe even in the middle school, is looking into your high school or middle school and see if they have an athletic trainer. That healthcare provider that's on campus is probably the one that's going to be enforcing or implementing all of these safety protocols. So I think, Rich, you mentioned this before, it's the new normal. And the new normal is you have to wear a mask when you get out of the car. You have to wear a mask in the locker room. Bring your own water bottle. Like Dr. Patukian said, don't share equipment, bring your own equipment, sanitize whenever you can. In some places, the athletic trainer is doing symptom checks and temperature checks before you even walk into the building. So I think for parents, it's important to talk to your kids about this is the safety protocol, and not only that, hey, this is something you have to do if you want to play, but why it's important. Because like Dr. Fiska said, it's not just when you're in school or at the practices, all the time. The more we practice these safety protocols on the field and off the field, hopefully the sooner we're going to be able to decrease the transmission rate and decrease the number of people that are affected.
Yeah, I completely agree. And, we've covered some really great questions, and I think it's important for us to also move on to some of the questions that have come from the audience, and which leads right into this one from Christopher out of Minnesota. Said, we particularly struggle with our sports teams creating guidelines, but not following them. What should parents or athletes do in those situations? I mean, this is critical. I've seen it across the board. We don't wear masks. We don't social distance. We're not. What should the parent that really, the whistleblower, so to speak, right? What do we have to do to make sure that we are enforcing the guidelines and protocols that need to be established so we don't have to be in this forever?
Yeah, that's a great question. I mean, in fact, one of the most popular billboards that was in the bubble that we had down in Orlando was see something, say something. Mm-hmm. It was anonymous, and people just, if they saw somebody walking around without their mask, they could submit it. And certainly, I'm not sure we can do that in our households, but we certainly can do it in our schools. And it is, again, establishing, as Dr. Fiskus mentioned, it's just establishing a culture of how we're going to be able to get through this. And I think most of our athletes and teams and schools are pretty well versed at being able to tackle things in an approach that, says that we don't want it to be with our sport. We don't want it to be in our team. We want to make sure that we represent. And so, we have to be good ambassadors. And so that, lends itself to the coaches and the parents in terms of being good ambassadors as well, right? Being good role models.
Right. I would add to that too, that I think it's important that, communication in this time is very, very important. So see something, say something, and it has to come from the top. If the sports organization is going to then implement that and make sure that they're reprimanding the coach or the athlete or whoever it was that was not following the guidelines, then that's great. But if the league or the team is just not following the guidelines, then that's something that the family has to decide, is this a risk we're willing to take if they're not going to be following the guidelines? And I think that's an individual decision where the family is going to say, if they keep not wearing masks or they keep not following the guidelines, then this might not be the best time for our child to participate with that particular team or league or whatever it is.
Mm-hmm.
Yeah, one of the things that I've worked with some of our colleges on is, if they feel like they can't make, for example, a mask mandate where it's required because they don't feel like they can enforce it in some way, or, it's just difficult, then to say that, our expectation is that you're going to wear a mask. Our expectation is that you're going to comply with social distancing and all of that. That helps to continue to build that culture without making things required or mandated or have the expectation that there's going to be some kind of punishment or penalty for not doing it, but just this is the culture we're building. This is our expectation, just like we expect lots of other things, that you'll show up on time, that you won't mess around during practice, that you'll give each other respect. We expect that you're going to wear a mask and protect your teammates while you're here, and it's going to take a little time, but this isn't going away anytime soon. So I think we've got lots of time to practice.
Yeah, that's very true. It isn't going away anytime soon. Another question from a parent we have, do you recommend high school sports like basketball in the gym allowing parents to be spectators watching inside? What are your thoughts on anybody?
It depends. It depends. Depends on the gym. It depends on the ventilation, and it depends on the spacing. So, I mean, I think if it's a small gym and you can't socially distance, then it would be an easy no.
Yeah.
Yeah, I think it depends also on the state association. Some state associations are going to just across the board say no spectators. So depending on the state and what rules have been passed, that might be an issue as well.
And I think it's important for us as parents, as Paul said, is for us as parents to set a good example. We're not allowed in the gym. We don't force ourselves in the gym and make a spectacle of ourselves because we want to watch our kid play. I mean, I have a daughter hopefully going to play. I'll have to watch her on the computer. I mean, that's how we'll have to do it. That's how we have to do it. That's how we have to do it. So,
Right.
Got another question from Joyce Lynn. She's from California. She said, how are water sports affected during this time? Interesting.
So, I mean, Dr. Fiskus can probably answer this as well, but I think that, my understanding is that chlorine kills the virus. So outdoor sports and in the pool are fine, as long as, again, the social distancing piece is the part that's important. So, and it's really almost impossible to wear a mask when you're in the pool. So it's really important. It's really important to try to manage that.
Yeah, wet masks are not a good idea. So you don't want to wear a mask if you're involved in a water sport, for sure. And you're exactly right. It's the water itself is not a concern. It's the proximity of the people. So water polo might be more of a risk than swimming. But you also have to be careful about what's happening on deck, and that we're not having people gathering on deck in close proximity to each other. That, you can come out and get on the blocks and swim your race and get out of the pool and stay distanced from one another. And you should be able to have a swim meet, especially if it's outside. But you can't be congregating on the pool deck or outside of the pool area and expect to be able to stay safe.
And from spectators in that particular case, what is your recommendation? None?
They just have to be able to be a part. So it's in some ways in aquatic centers, the humidity might work in our favor because this virus, respiratory viruses tend not to transmit as well in humid conditions. But we certainly can't rely on that. And you've got to be able to set it up so that people can be at least 6 feet from each other, and you have to require that they wear masks.
Gotcha. All right, we've got another question from another parent. How many people do you recommend having in a cohort for practice purposes, say at the youth soccer level? Is there a certain number, or again, we go back to the social distancing component? Rebecca, I'm sure you could.
Sure, I'll start it off, but I'm sure I'll get help from the other panelists. Everything that I've read says groups of 10 or less. Again, if you're able to keep that 6 to 8 foot distance would be best, but especially as Dr. Fiskus alluded to earlier, is having that cohort, right? So not mixing the groups. So if you're gonna have those small groups, is have that group work together and not intermingle with the other groups. I think that would be one of the safest ways to do it.
Yeah, I think specifically for the sport of soccer, I think U.S. Soccer, and I know with MLS, we sort of had this phased approach where phase 1 was individual training, phase 2 was group training, but they were groups of 5 or 6, and they stayed in their zone, and the only difference was that they would pass a ball from one zone to the other, and they'd shoot on goal, and then phase 3 was getting them into full play. So I think that for that sport in particular, I'd probably go with 6, but I think you're right. Otherwise, that's sort of the groupings.
Okay. And we got another one here. Question from parent. In terms of mental health, what are warning signs or red flags that parents and coaches should be looking for in student athletes? Once it seems like there might be something to check out, what do you recommend they do?
That's a great question. We just literally, the AMSSM has a position statement on mental health and psychological issues in athletes. And I know the NATA has done that as well as I'm sure the AAP has something. But I think the main thing is, obviously, we talked previously about some of the emotions that we sometimes see with this disease and in this situation in terms of sadness and anxiety and fear. But I think if you all of a sudden see your son or daughter more withdrawn than usual, they're having issues with their sleep, if they feel like they just don't want to do the things that they typically like to do, and it just seems a little bit more intense or persistent, I think those are certainly red flags. Obviously, if somebody were to, ever mention anything about any thoughts of it being better off dead, those are obvious red flags, but it's important that you take those things seriously. Sometimes, I think we all don't want to hear that kind of messaging, but, so if you do see any of those kinds of red flags, whether it be someone's having issues with sleep or having issues with their appetite or just more withdrawn, I think it's really important that you, depending on your comfort level, try to open up some lines of communication and talk. But seriously, I would really encourage individuals to get professional help, because it's something you don't want to ignore. It is a challenging time. I think the NCAA had a study in the spring, and there were a significant number of student athletes at the collegiate level that were really struggling with depression and anxiety. And it's certainly an important thing to be watchful for.
One thing to keep in mind about adolescents, and it's hard sometimes to know when adolescents are depressed, because they're already moody and want to be in their rooms by themselves. And now we're kind of in lockdown too, and telling them that they can't really be social like they want to. But adolescents, whereas adults tend to get kind of more tired, sleep more, don't eat as much, withdrawn. Adolescents tend to get really crabby and irritable when they're depressed. And so don't think that that's just, your adolescent, kind of going through an being a jerk phase. Sometimes that's depression that's actually speaking out with that. So just be in tune to that if your adolescent is acting more irritable than what they typically are.
And angry, right? And they can get really angry and.
Yeah. So that, a lot of that just flip as a switch, flying off the handle, walking on eggshells kind of feeling that you sometimes get with your kids. If that might be worth a sit down with them to find out, exactly how they're feeling and how they're coping with this.
Completely agree. Communication is always key. Always key. Another question from a parent. My son is a first-year head football coach and is considering having a sports psychologist address his team. What do you guys think of that?
That's a great idea. I think having a clinical psychologist that understands sports really helpful, because again, so many of our youngsters are dealing with all kinds of emotions and all kinds of feelings, and so I think it would be helpful.
I agree. That's a great idea. I wish every team were able to do that.
Yeah.
Well, it's awesome. All right, so see what else we got. Last question. Last question from a parent. Do the ages of kids, elementary versus high school, for example, affect any of these recommendations at all?
Yeah, they do to an extent. So we know that younger children are less likely to transmit the virus and less likely to become ill with the virus. As children get older, they start to act a lot more like adults. And so we start to see adolescents spread the virus, react to the virus in ways that are similar to adults. So for those littles that are, running around playing what I call amoeba ball when they're in soccer and they're just like in a great big lump of little kids all the time, they're probably less of a concern in an outdoor space, especially than we are when we start getting into the higher elementary, middle school, high school, certainly collegiate sports, as far as their what seems to be their ability to transmit. Similarly in schools with masking recommendations, we're a little more comfortable having the young kids, early elementary school kids, forego a mask if they can stay reasonably distanced, and get really uncomfortable with the older middle school, high school kids and adults going without that. And it's for the same reason.
Gotcha. Anybody else want to weigh in on that, or you think that?
I'll just add that I think the younger kids are also less likely to physically distance. Like they're more likely to forget. I have a 4-year-old and she wears the mask, but when you're like, stay back, she just immediately forgets and gets close. So I think that's a concern for the little ones.
Yeah.
Lots of hand sanitizer.
Compliance is always key, right? I mean, it's younger, less compliant.
Yes.
Well, I want to thank everybody. That's all the time we have for today. A reminder to our audience, join us for part 2 and 3 of our series tomorrow and Thursday at 7 p.m. Central, 8 o'clock Eastern, and discuss safety precautions for you and your child's team, as well as special considerations for junior and senior athletes looking to play at the collegiate level. That'll be on Thursday. There is still time to register for both of those events. Feel free to share any insights you've gained from our discussion on social media using a hashtag #PlayInformed. If you have any questions at all, email marketing@nata.org. Again, that's marketing@nata.org. Again, a special thank you to all our panelists who shared awesome experience, awesome information. Really appreciated the time and the discussion. I hope it was helpful to all the parents out there. Thank you.
Thanks.
Thank you. Have a good night.
Thanks, everybody.
Take care. Have a good one.